Now, still related about COVID-19, health authorities in Rwanda say a COVID-19 patient who does not show symptoms is allowed to be discharged after 14 days because the risk of infection is very low. This is part of a statement issued by the Rwanda Biomedical Center announcing the revision of the care system for COVID-19 patients undergoing the home-based care. During a phone interview, Dr. Saben Sanzimana from the Rwanda Biomedical Center expounds more on this.
We're getting new evidence, new research coming out about how this virus is transmitted. So there are two things that now we have to understand. So being positive and being infectious. The new data, the new evidence we have is that 14 days after someone got infected, the level of transmissibility is extremely low, and we've been having people in households waiting for 2 weeks to see doctors coming to test them. And given this new evidence, we think that with the availability of rapid tests at health centers now, at health facilities and private clinics, and we don't need to have doctors going into households if someone can self-isolate for 2 weeks, and at the end of 2 weeks go for a test. The second thing is also the number of cases continue to increase, and it was becoming almost impossible for doctors to follow in each household across the city and across the country to test everyone from home. If we can avail these tests at health facilities near people's houses. So it's an interesting move supported by science, and that's why we've also changed or adapted our guidelines accordingly.
I see. So you mentioned that there's a difference between one being positive and one being infectious. At what point does one move from being infectious to non-infectious? At what period of time does that take? Yeah,
it takes generally between 10 to 14 days. Some countries have opted for 10 days, including actually the World Health Organization new recommendations. But for Rwanda, we were keeping the 14 days just to be sure that even the lowest level of risks are controlled. So if you test today positive for COVID-19 and you self-isolate for 2 weeks, that level of being infectious is going down. Therefore, you can go to control tests at the end of this period. And this is what we're emphasizing in these new regulations.
But Dr. Sabe, won't this make people complacent if they feel like they don't have to be followed up to do another confirmatory test after the quarantine? Doesn't this pose a risk?
Well, we need to be clear that we're not saying that at the end of the 14 days there's no need for a test. It's actually there is a need for a test, but the test doesn't need to be done at the household. If someone can move to the health center or the private clinic to access this test, instead of waiting doctors from, let's say, central command post or district hospitals to go into each and every household. So this is what we want to clarify here.
And at that point when one is required to do a confirmatory test, who incurs the cost? The patient, or is it still free of charge, or they are paying for it?
It's still free of charge, for sure, in this public health context. So that's why you're availing this rapid diagnostic test at hospitals and the health center levels. And for those who want to pay this cost, because there's maybe a certain level of, let's say, conveniency that goes about it. So it's about the nearest facility. It could be public, it could be private. But at private facilities also, the cost for this antigen rapid test has been agreed upon to not be more than 10,000 francs. And this could be also the fee that some people may want to pay. But for public facilities, there's no cost for those who will be choosing to take this option.
Absolutely. Just to be clear, Dr. Sebe, after the home-based care, when one is required to do a confirmatory test, does it have to be a PCR test or a rapid antigen test? Or does either work?
Yeah. PCR or rapid diagnostic test, both are accepted. And I understand rapid tests will be much cheaper and much easier and probably more available than PCR that takes time and process also is not that easy. But any of those two tests is acceptable.